Welcome to the Shared Medical Services Benefits Orientation. I'm Melinda Crawford and I will be walking you through this presentation to explain the benefits that are offered here at Shared Medical Services. The rest of the HR team contact information, such as email and phone numbers, can be found at the end of this presentation as well. Upon meeting eligibility requirements, full-time SMS team members may participate in our comprehensive benefits package. This presentation will help guide you through the available benefits options and includes links to access each provider website. We will be reviewing your voluntary benefit options such as health, dental, vision, and life insurance, as well as providing information about our employer-paid benefits, 401k retirement plan, and employee stock ownership program. You will have 30 days from your full-time employment date to make your elections choices. You will be receiving an email with electronic copies of the benefits documents within your first day of full-time employment. If you would prefer hard copies of the benefits information, please let HR know. This email will contain instructions on how to make your elections in Payroll and Benefits System, ADP. Additional information can also be found on the SMS portal. Coverage for all of your benefits elections will begin the first of the month following a 30-day waiting period. First, let's discuss the glossary of common insurance terms that will be referenced throughout this presentation. Then we will discuss details on the available benefits. The following slides contain important terms we will be using in this presentation. Terms are in alphabetical order and will hopefully provide you with a deeper understanding of your benefits. Feel free to pause the presentation so you can take time to read each definition at your own comfortable pace. The allowed amount is also referred to as the eligible expense, payment allowance, or negotiated rate. It is the maximum determined amount that can be paid for healthcare services. Balance billing is the difference between the provider's charge and the allowed amount. And coinsurance is your share of the cost of a healthcare service calculated as a percent of the allowed amount for that service. We will review the coinsurance amounts for the SMS medical plan shortly. A claim is a statement that the provider sends to the health insurer. Claims for shared medical services team members are sent to Oxient, our third-party administrator, to process. Co-payments are the fixed amounts that are paid when receiving medical care or prescriptions. SMS only has co-payments for prescriptions and emergency room visits. You can look at the summary of benefits coverage for those details. A deductible is the amount owed for healthcare services that team members must pay before the plan pays. For example, the SMS health plan has a $1,500 per individual deductible, which is the out-of-pocket cost that must be paid before the insurance will pay anything towards claims. Routine doctor visits are considered preventative and are covered at 100% if using an in-network provider. Once the claim is processed, Oxient will send an explanation of benefits, or EOB, to explain the services that are being paid by the plan and the amount that will be owed by the patient. EOBs are not bills, and it is recommended to hold on to them at least until the bill from the provider is actually received. Then you can compare the patient responsibility amount due with the bill. The EOB will also show year-to-date totals that have been paid toward the deductible and the out-of-pocket limits. It is very important to use providers that exist within your designated network or in-network services. The network consists of facilities, providers, and suppliers that SMS has contracted with to provide healthcare services. Out-of-network providers do not contract with the SMS plan. Your in-network and out-of-network coinsurance amounts are separate. We talked about coinsurance in the previous slide, but in-network coinsurance costs you less than out-of-network coinsurance. To compare, your out-of-network coinsurance is 40%, but your in-network coinsurance is 20%. The out-of-pocket limit is the most you could pay during a policy period before the plan begins to pay 100% of the allowed amount. There are different out-of-pocket limits set for in-network and out-of-network services once again. This amount does not include your premium, balance billed charges, or services that are not covered by insurance. This amount is applied to the deductible, prescription copays, and coinsurance amounts paid. The SMS medical plan is a PPO, or preferred provider organization. This is a plan in which hospitals, physicians, and other providers agree to discount rates for a designated network for an insurance company. Insurance contracts that are set within a PPO reimburse at a higher amount if you utilize in-network providers. A premium is the amount team members will pay to obtain or maintain health coverage. SMS takes biweekly deductions from your paycheck to pay for these premiums. A provider is a hospital, pharmacist, nurse, organization, institution, or physician in your location. The term provider is used to identify individuals or facilities that provide healthcare services. Now that you have a better understanding of common insurance language, the next slides will provide details on our specific plan offerings. Regular full-time team members are eligible to elect medical, dental, and vision insurance. Shared Medical Services also provides flexible spending options for medical and dependent care. In addition, we provide employer-paid basic life, basic accidental death and dismemberment, and short-term and long-term disability insurances at no cost to you. Additional life and AD&D insurance can also be elected by team members. Shared Medical Services maintains our own self-insured health insurance plan as opposed to purchasing a fully insured plan from an insurance carrier such as Blue Cross and Blue Shield. We have a third-party administrator for the health insurance called Oxient. Your health insurance ID cards are managed by Oxient and contain information such as the member ID, selected network, benefit verification, pharmacy plan information, pre-certification numbers, and claim submission addresses. Oxient performs managerial and clerical functions for the administration of our self-funded benefits plan. They also determine eligibility and enrollment, work with the different networks, develop forms necessary to administer the program, adjudicate claims and process benefits, as well as communicate with networks that provide you with the customer service. SMS offers one medical plan called the SMS Health Plan. We will review the premiums later in this presentation, but it is important to note the difference in savings when you utilize in-network versus out-of-network services. Generally, you must pay all of the costs from providers up to the deductible amount before this plan begins to pay. If you have other family members on the plan, they also have to meet their own individual deductible until the overall family deductible amount has been satisfied. If the doctor, hospital, or healthcare facility you visit is part of your network, you will generally receive healthcare at lower costs. If you go out of network, your healthcare costs will likely increase significantly. In-network and out-of-network services contain separate deductibles and out-of-pocket limits. Think of it like two buckets. In-network providers get paid from one bucket, and the out-of-network providers get paid from the other. Next, let's discuss some examples of services you may need to better understand the possible associated costs. In-network providers will cover 80% of insurance claims after the deductible is met, and out-of-network providers cover 60% of claims once the deductible is met. The 20% and 40% coinsurance that is listed is your share of the payment for the medical services provided to you. Your services will be billed as a claim. There is also a $150 copay for emergency services in addition to the coinsurance amounts. We have a 4-tier prescription plan with copays, and remember, copays are the fixed costs. In our plan, generic drugs cost $10, preferred brand name drugs cost $30, and non-preferred brand name drugs cost $50. The 4th tier is for specialty drugs, and the cost is 20% of the retail value to a maximum of a $250 copay. Our SBCs, or Summary of Benefits and Coverage document, provides information for mail order and limitations, as well as exceptions for these tiers. Please contact the HR department if you require a drug formulary to distinguish which tier your prescriptions may fall. Preventative services are covered at 100% by insurance for in-network claims under the regulation of the Affordable Care Act, also known as the ACA or Obamacare. Services include annual routine well care, such as an annual visit with your preferred care provider, or PCP, annual vision exams, flu shots, and routine surgeries. Again, please review the Summary of Benefits and Coverage or Summary Plan document for limitations and exceptions to any of these services. Included with our medical insurance, Teladoc is a free service that provides 24/7 physician consultation over the phone or mobile app. This allows you to access quality care for certain health conditions over the phone, and that saves you time and money required with office and ER or urgent care visits. This added benefit is available to medical plan members at no cost and can reduce your overall healthcare costs. There is a flyer in your new hire materials that contains more information. Bi-weekly premium costs for the SMS health plan are listed here. Premiums are deducted each pay period on a pre-tax basis, up to 26 pay periods per year. This means that contributions are taken out of your paycheck before taxes are applied, and this results in a reduction of your taxable wages. As we discussed earlier, medical plans utilize networks. The name network comes from the large group of physicians, hospitals, and other healthcare providers that have agreed to provide medical services to a health insurance plan's members at discounted costs. This slide contains the shared medical PPO network listing. Preferred provider organization plans allow you to visit whatever in-network physician or healthcare provider you wish without requiring a referral. These networks are based on the state you live, and if your state has an asterisk in this list, you have more than one option for a network, but please pay close attention to the counties that are listed. Please contact the HR Benefits Department if there are any questions regarding your network. You can use the links in this presentation to visit each network website and search for providers to determine if your doctor is in your preferred network. You have flexibility to visit providers, hospitals, and facilities outside of your network. However, keep in mind that visiting an out-of-network provider includes a higher fee and a separate deductible. Shared Medical Services has a working spouse provision in place. This means that a team member's spouse who has his or her own offer of coverage with his or her employer is not eligible on the SMS plan. Dependents through age 26 are eligible for medical coverage regardless of student status, marital status, employment status, or other available coverage or residence. Oxient will reach out to individuals upon first-time enrollment and on an annual basis to confirm spouse eligibility. Delta Dental is the provider for our dental insurance. The working dependent spouse provision does not apply, however, coverage eligibility varies slightly for dependents. The child is covered to age 26 only if he or she is a full-time student. Otherwise, there is coverage up to age 19. Premiums are listed per pay period, and these are also pre-tax deductions via payroll. Preventative services such as annual visits and cleanings are covered at 100%. There is an annual deductible of $25 per individual or $75 per family. Our late entrant option allows for annual enrollment if you do not elect this benefit upon hire. You can use the link in this presentation to find providers for dental services and see if your own dentist is in the preferred network. Delta is also the carrier for our vision insurance. However, IMED is the administrator. Like our dental insurance, the working dependent spouse provision does not apply. Coverage is also available to dependents through age 26. If you choose to use the Access Network for vision benefits, you can find a provider by using the link in this presentation. The main thing to take away is that prescription eyeglasses and contact lenses cannot be purchased in the same year. Lenses for eyeglasses or contacts may be purchased every 12 months, and frames may be purchased every 24 months. The eligibility date of your next purchase is based on the date of your last purchase. These benefits do not reset after the new plan year begins. Task is the administrator for our flexible spending plans. Shared Medical Services allows for a grace period after December 31st, unlike most plans. Those who elect medical FSA can incur claims to apply to current year funds all the way through March 15th of the following plan year, and they can submit reimbursements for claims not paid by the FSA card through March 31st of that year. After March 31st, funds will be forfeited. Team members that elect FSA get a debit card to use for eligible expenses. These cards will be sent directly from Task to your home residence. Contributions for FSA are also collected bi-weekly on a pre-tax basis through payroll deduction. The Healthcare Flexible Spending Account is used for eligible medical, dental, or vision expenses that are not covered by insurance. You can use an FSA for copays, bills, glasses, contacts, etc. The enrollment materials also contain a few documents with a list of eligible expenses. There is an annual maximum election of $2,650 for 2018. There is also an FSA option for dependent care, which allows for daycare services for children under the age of 13 and disabled adult children, spouses, or relatives. The maximum annual election for dependent care flexible spending is $5,000 per household. That means that an SMS employee and his or her spouse can take an election of $5,000 combined for 2018. Both flexible spending benefits are monitored under IRS regulation. Shared Medical Services provides employer-paid benefits at no cost to you, and you are automatically enrolled. All eligible full-time team members receive voluntary life and accidental death and dismemberment insurance coverage at an amount of 1 times your annual salary to a maximum of $50,000. SMS also offers spousal life coverage of $10,000 and dependent life coverage of $5,000 to age 19 or 26 if a full-time student. Shared Medical Services also provides short and long-term disability insurance. Short-term disability max period of payment is 13 weeks, and long-term disability pays out afterwards. Short-term disability pays benefits based on weekly earnings, and long-term pays benefits based on monthly earnings. Both benefits are paid directly to the team member from the insurance carrier, Unum. We promote an appropriate work-life balance, and therefore we offer an Employee Assistance Program, or EAP. The EAP offers services such as locating childcare and elder care, speaking with financial experts, will preparation, as well as access for videos, online seminars, and guides for services that you may need. The EAP also has travel assistance, which provides services such as emergency evacuation, replacing passports, or prescriptions. There are 2 wallet cards that are provided with your new hire enrollment materials. Please be sure to hold on to them. Team members also have the opportunity to purchase additional life and accidental death and dismemberment, or AD&D insurance. Premiums for these additional insurances are deducted bi-weekly through payroll. Team members can elect increments of $10,000 to a maximum of the lesser of 5 times the annual salary, or $500,000. Spouses may elect increments of $5,000 to a maximum of the lesser of the team member's total election, or $500,000. Dependent children can have coverage in increments of $2,000 to a maximum of the lesser of the team member's total election, or $10,000. The annual enrollment period occurs generally in November or December of each year. During this time, team members can make changes to elections. No medical underwriting is needed for AD&D, which means no additional medical history is needed to have these elections approved. For voluntary life insurance, rates are based on an age range or age band as listed here. Team members can elect increments of $10,000 to a maximum of the lesser of 5 times your annual salary, or $500,000. Unlike AD&D, there is a guarantee issue amount for this insurance. This means that team members can elect up to the guarantee issue without requiring medical underwriting or asking for a full medical history. The guarantee issue amount for team members is $150,000. Spouses may elect increments of $5,000. The guarantee issue amount for a spouse is $25,000. Dependent children can have coverage in increments of $2,000 up to a maximum of $10,000. There is an annual enrollment period that takes place in November each year for voluntary life insurance as well, and during this time, team members can make changes to elections. If voluntary life insurance is not elected within your first 30 days of hire, an evidence of insurability form must be submitted for all new enrollees, even if electing under the guarantee issue. Again, here are the age band amounts and an example of a team member who is hired at age 40. For your convenience, ADP does this calculation for you when you elect your benefits. Shared Medical Services sponsors a retirement savings plan. A 401k plan allows you to save and invest portions of your paycheck before taxes are taken out. Knowing how to build your 401k retirement plan, devising investment strategies, and making the most of your plan all help to financially secure your path to retirement. We are proud to be a 100% employee-owned organization. An ESOP is a retirement plan that is designed to provide team members with an ownership interest in Shared Medical Services by investing in company stock. By meeting eligibility requirements for our ESOP, you become an SMS owner. Team members are provided with such ownership with no upfront costs. More information regarding the ESOP can be found on the SMS portal under the ESOP tab. There is a very helpful video that can be watched to explain the process. In summary, you have 30 days from your hire date to complete the online enrollment through ADP. for all of your elected benefits, including medical, dental, vision, flexible spending, voluntary life, and accidental death and dismemberment. There is a 6-month waiting period following your hire date to enroll in your 401k retirement plan. You are automatically enrolled in the Employee Stock Ownership or ESOP plan. Future enrollment opportunities may be available due to a qualifying event. And additional copies of benefits information can be provided upon request or by visiting the SMS portal. More benefit information is available on the SMS portal and ADP, including summary plan descriptions, member certificates, and links to the benefit plan websites. Additional information on the ESOP, 401k, and basics of understanding your benefits are available on the portal as well. If you have any questions regarding our benefits or any other employment-related items, please contact a member of the HR department. Benefits questions can be directed to me, Melinda Crawford. Payroll and timesheet questions, workers' compensation, and leaves of absence to Heather Harnack. Credentialing and driver qualification questions go to Marisa Joyce. Nicole Window can be contacted for recruiting, and Bridget Travnik is available for any HR-related questions. Welcome to the SMS team. We are happy to have you here.